A patient with retained tampon and fever should be investigated for blank. A. Pelvic inflammatory disease. B. Toxic shock syndrome. C. Ovarian torsion.
Answer.
B. Toxic shock syndrome. Fever plus retained tampon should raise suspicion of toxic shock syndrome, not PID or ovarian torsion. Which of the following is not a classic symptom of toxic shock syndrome? A. High fever. B. Hypotension. C. Bradycardia.
Answer.
C. Bradycardia. TSS presents with tachycardia, not bradycardia. Fever and hypotension are key diagnostic features per NICE guidelines. What is the first-line management step for a suspected retained tampon with infection? A. Immediate IV antibiotics. B. Removal of the tampon. C. High-dose steroids.
Answer.
A. Removal of the tampon. The first step is removing the tampon to eliminate the source of infection. IV antibiotics and supportive care follow.
If you're enjoying this video, subscribe to PLAB Diaries. Are you ready for the next question?
Which antibiotic is not recommended for toxic shock syndrome management? A. Flucloxacillin. B. Clindamycin. C. metronidazole.
Answer.
C. Metronidazole. In the effective management of toxic shock syndrome, flucloxacillin and clindamycin are recommended as the primary treatment options. These medications target Staphylococcus bacteria specifically and play a crucial role in suppressing the associated toxins. How long should a tampon safely be retained to avoid infection risk? A. 4 hours. B. 8 hours. C. 24 hours.
Answer.
B. 8 hours. Tampons should be changed every 4 to 8 hours to reduce TSS risk. What is the most common causative organism in toxic shock syndrome, TSS, due to retained tampon? A. Staphylococcus aureus. B. Escherichia coli. C. Streptococcus pyogenes.
Answer.
A. Staphylococcus aureus. Toxic shock syndrome is primarily caused by the exotoxin known as toxic shock syndrome toxin 1 or TSST1, which is produced by Staphylococcus aureus. In addition, Escherichia coli and Streptococcus pyogenes are recognized as less common etiological agents of this condition.
Get ready. It's going to get harder now.
A 19-year-old woman presents with a fever of 39 degrees Celsius, hypotension of 80/50ths of a millimeter of mercury, and a diffuse erythematous rash. Upon examination, a retained tampon is discovered. What is the most likely diagnosis?
Answer.
Toxic shock syndrome or TSS. The classic triad of fever, hypotension, and rash, coupled with the presence of a retained tampon, strongly indicates staphylococcal toxic shock syndrome. It is imperative to remove the tampon immediately and administer intravenous fluids as part of the critical management protocol. A woman with toxic shock syndrome develops confusion and tachypnea. Blood gas shows lactate 4.5 millimoles per liter. What is the next urgent step?
Answer.
Aggressive IV fluid resuscitation. High lactate indicates septic shock. Why is clindamycin added to flucloxacillin in toxic shock syndrome treatment?
Answer.
To suppress bacterial toxin production. Clindamycin is added to flucloxacillin in the treatment of toxic shock syndrome because it helps to inhibit bacterial toxin production, which is a major factor in the severity of toxic shock syndrome. A patient with recurrent toxic shock syndrome asks about prevention. What is the key advice regarding tampon use?
Answer.
Here are 3 recommendations for tampon use aimed at preventing toxic shock syndrome. 1. Consider avoiding the use of tampons whenever possible. 2. If tampons are used, Ensure they are changed every 4 to 8 hours. 3. Opt for low absorbency tampons rather than super absorbent varieties. For patients with a history of recurrent TSS, the most effective preventive measure is to abstain from using tampons entirely. Prolonged tampon usage has been associated with an increased risk of toxic shock syndrome. In alignment with NICE guidelines, low absorbency tampons combined with regular changes are advised.
What if you could make eye-catching animations faster than ever, even with zero experience? Introducing Create Studio, you're an all-in-one video editor solution. With Create Studio, you can effortlessly craft amazing animated videos in just minutes. Explore its extensive library of effects, templates, AI voiceovers, and creative captions to truly bring your stories to life. Join thousands of satisfied users. What are you waiting for? Try Create Studio now and unleash your creativity like never before. Click the link below to learn more.